Okay, I'm Sydney Stoltz, and this is my last and third video. We're going to be DCing the IV and giving an IV push. So we'll go ahead and get started. Okay, so it looks like I have an order here for Mr. Banana. Dilaudid, 2 milligrams, IV push, every 2 hours for pain. Okay, and the dosage strength is 2 milligrams per mil that I'm going to be working with. So I'm going to be giving 1 mil over a period of 4 minutes. Okay, but before we get into any of that, I'm going to go ahead and wash my hands. I'm going to verbalize for you the 6 rights. So right patient, right dose, right med, right time, right route, and right documentation. Okay, so I've washed my hands. I'm getting ready to go take off that continuous IV. I'm going to enter the room. Hello, Mr. Banana. Can I get your name and Coda?
Name is Banana 121490.
Perfect. Thank you. Okay. So I'm going to go ahead and remove this. Okay. And then once that's done, I don't know if I'm going to need this tubing again, so I'm going to save it. And the way that I'm going to do that is I'm going to take the end and I'm going to attach it to one of these things on the same tubing. Okay, once that's done, I can go ahead and do my IV push. So I'm going to need an alcohol swab. Okay, so I'm going to clean the port. Awesome. Okay, so I have sterile saline right here. So I'm going to flush it with sterile saline to start out. I need to flush it with 5 mils to flush the rest of the medicine that's in there and also ensure that my vein is still open. Okay, so there's 5 mils, awesome. So I'm going to remove it, set it aside. I'm going to take my alcohol swab right through over here. I'm going to clean it again. Okay. And now for the Dilaudid. So I didn't have the syringe that they wanted us to use, I guess. So I just used a regular sterile saline thing. And we'll just pretend it's Dilaudid. So 4 mils is in here. I'm going to screw it on. Okay, and the order is for 2 milligrams. So I need to give this over 4 minutes. So that's a rate of 2 mils a minute. So let's just pretend that 4 minutes has gone by. Perfect. We'll unscrew that, discard, clean the site again, and we need to flush it again. Okay, so 5 mils of sterile saline again, and make sure that you don't go too fast on the flush so that they don't get too much medicine at once. Good. Okay, alright, so we're ready to DC. I have gloves on for that whole procedure, just to note. Okay, so we're ready to DC the medicine, or the IV. So, we're going to need our gauze and a thing of tape. Okay. And we're going to peel this back. Okay, and then, shoot, I should have opened my gauze first. Okay, so I have my sterile gauze there, and I should have gloves on. Let's just pretend I have gloves on. Okay. So I'm going to apply firm pressure before I remove the IV site. Okay, and then I remove it. Come on. Sorry. Okay, let's back up a little. Okay, I need to remove my little loop here. I forgot about that. Okay, now we're ready to remove. Okay, so firm pressure, remove, discard into the sharps container. Looking good so far, no excessive bleeding or anything like that. I'm gonna apply firm pressure here for 2 to 3 minutes, and then after that, I'm gonna tape it up, and it should be good. I'm gonna wanna assess the site for like redness or anything that looks abnormal, and he looks good. So I'm done here. I'm gonna go document. So thank you, Mr. Banana. Here's your call light. Anything else I can get you?
No, thank you.
All right, thank you. So I'm gonna go document what I gave him, when I gave it to him, how I gave it to him, how the IV site looked, and any other pertinent information, and that should do it. So that's it.